Quick question. Do people come to you for answers at work? Maybe you're managing projects, training new hires, or just the one everyone relies on. That's leadership. Through UVA Darden's part-time MBA in Roslyn, we help professionals like you turn real-world experience into recognized leadership credentials without stepping away from your career. Whether you work in healthcare, education, government, or business, this is how you take the next step. Learn more at darden.virginia.edu/PTMBA.
Amazon Health AI presents Painful Thoughts.
Why did I search the internet for answers to my cold sore problem? Now I'm stuck down a rabbit hole filled with images of alarmingly graphic sores in various stages of ooze. I can clear my search history, but I can never unsee that.
Don't go down the rabbit hole. Amazon Health AI gets you the right care, fast. Healthcare just got less painful.
Kathy Stein saw how her brother Eddie lit up every room he walked into. His enthusiasm for life was infectious. Eddie would talk to anyone about his favorite hobbies, from steam trains to photography. It was hard to catch him without a camera or two strapped around his neck. But after Eddie was diagnosed with a terminal disease, he, Kathy, and their 3 sisters were forced to think about his end-of-life plan. In her research, Kathy came across a unique subset of science, brain donation. And with Eddie having been diagnosed with autism, his brain would be valuable in advancing research in that field.
We understood in our family, as Eddie's very wide circle of friends did, that he had a really beautiful mind. I mean, his brain was something very special. So the idea of his brain just being wasted was just horrifying to us. So I, as his legal guardian, had the responsibility of trying to think in his brain, think wearing his shoes, what would he have desired? And it really came to a head when he had pneumonia. And that was when we both put the DNR in place and also reached out to Autism BrainNet.
Autism BrainNet is a program of the Simons Foundation Autism Research Initiative. Its goal is to use brain tissue to understand the biological causes of autism and identify treatments that improve the quality of life for people with autism spectrum disorder. Dr. David Amaral, scientific director at Autism BrainNet, says that its creation 14 years ago stemmed from frustration of a lack of research opportunities.
I wanted to do postmortem autism research to try and answer some of these questions. But when I went to the available sources of autistic brains, there really was on the order of tens, like 10 brains or 20 brains. In fact, we did a very large study in the early 2000s, and I think we had something like 22 brains in that study, and it was considered to be a large study. So we realized that we have all these incredible scientific techniques now to study the postmortem human brain. But the bottleneck was that we just didn't have the material to be able to enable those kinds of studies.
Since they're only being used for research purposes, brain donation isn't included in the standard organ donation registration. It requires a separate process that many people aren't aware of, which has proven to be a main obstacle for Autism BrainNet. While we have ways to look at the brain of a living person, Amaral says being able to explore the tissue up close provides invaluable information for various conditions.
Alzheimer's disease, which is getting more and more prevalent, was first discovered in 1906 by a pathologist who studied a woman who had dementia, and he was able to study her brain, and he discovered the plaques and tangles that are characteristic of Alzheimer's disease. So that was over 120 years ago. But because of that discovery, we now know what causes those plaques and tangles, and that has led to a variety of efforts to come up with preventative measures or treatments.
But while Alzheimer's research has seen major advancements in knowledge over the last century, other conditions like autism are just beginning to access this type of investigation.
We have just begun to acquire postmortem brains for doing research. And our hope is that by carrying out postmortem brain research, we'll be able to understand really the causes of autism at a cellular and molecular level. And that ultimately will lead to better treatments to improve the quality of life of living autistic individuals. So these brain donations are really a valuable and critical resource that enables state-of-the-art research to be carried out.
Research that was thought to be science fiction back when Amaral was a student.
The very first postmortem studies of autism weren't done until the 1980s, but again, on like 4 to 6 brains, not a very large number of brains. And it's only now in the last 5 to 10 years that people are able to do well-powered studies, and largely due to the fact that Autism BrainNet has been able to gather these donations from members of the community that see the value in this kind of research.
The donations can also be from non-autistic individuals whose tissues will be used as a control group in this research. There's no cost to the family, and Autism BrainNet handles all of the donation logistics. After someone dies, a loved one calls Autism BrainNet's 24/7 number 877-333-0999. The organization will dispatch a member to acquire the brain and ship it to one of their 3 collection sites. After Eddie passed, Kathy's sister called the hotline and arranged for the tissue to be collected at a funeral home.
We do require that brain donations come in within 48 hours after a person's death, but it's even better if the donation can come in within 24 hours or even shorter. And the reason is that when a person dies, all of their organs start to change, start to deteriorate, and we want to study the brain of an autistic individual as closely as it was to life as it can be. So the longer the delay between when a person dies and when we acquire the brain, the less likely it is to represent the brain when it was in the living person.
Once the tissue is preserved, after some time has passed and the family is ready, Autism BrainNet will reconnect with them to get more information about the donor's life.
What were they like? What kinds of characteristics did they have? We also asked them for their medical records so that we can see, for example, 30% of autistic individuals also have epilepsy. Well, epilepsy is a neurological condition as well, but we need to know that when we're studying the brain tissue from that particular donor because it has implications for the results that we see. We do all that to gather as much information and to confirm the diagnosis if the person was autistic to ensure that really they did have autism.
After that, the team reaches out each year to check in on the families and update them on the research their loved one's donation is helping with. Autism BrainNet also sends out a quarterly newsletter that anyone can sign up for that dives into the science that's being done with the donations. Each brain is able to be used by scientists around the world for decades to come.
And each brain can support research by hundreds of studies. So we realize that this is a valuable and precious resource, and we do everything we can to preserve it in an optimal way to make it valuable for doing science.
Amaral says this research is the only way we'll be able to understand the biomedical causes of autism.
We can look at the autistic individuals behaviorally. We can do MRI analysis of their brains, and all of that is important research. But to get down to the point of understanding the neurons and their connections and chemistry of autism, we need to look at the brain, and it's only that level of analysis that will ultimately lead us to better drugs to treat autism, as well as a lot of the co-occurring conditions.
When Amaral refers to treating autism, he doesn't mean curing it. The goal of treatment is to improve the quality of life for autistic people, not reprogram the DNA of who they are.
We're not necessarily doing this research to cure autism. There's many positive aspects of autism, and Kathy mentioned several about her brother and what an incredible artist he was. And where our goal is to try and understand what causes some of the debilitating co-occurring conditions like epilepsy or anxiety.
A large portion of people with autism have anxiety conditions, serious sleep disorders, and gastrointestinal issues as well. Amaral believes that by studying the brain, they can figure out what's causing these debilitating conditions and be able to treat the root of the problem.
And from my perspective, if we could simply treat the anxiety component of autism and reduce or eliminate anxiety from an autistic person's life, it's going to make their life that much better. And that's what our goal is, to make the lives of autistic people that much better.
Amaral says the current anti-anxiety medications on the market don't work the same way in people with autism as they do in neurotypical patients.
A lot of the anti-anxiety medications that are used for neurotypical individuals actually have been tried. Many of them actually do not work as well in autistics as in neurotypical individuals. So there is not a standard of practice at this point in time for an anti-anxiety medication in autism.
Even non-pharmacological treatments like cognitive behavioral therapy don't work in the same way for these individuals.
We're really in the early stages of evaluating how well that works in autistic individuals. And again, part of the issue is that we do believe that the autistic brain is different in some ways than a neurotypical brain. Those differences may make some of the drugs that we use for treatment of anxiety or sleep conditions actually work in not as expected. In some cases, they work in the opposite way. So an anti-anxiety medication may make somebody more agitated. So we need to understand that. We need to know, what are the best treatments for these kinds of conditions in autism? And that's what our goal is.
People with autism not only have structural differences in the brain compared to neurotypical people, but also with others on the spectrum. A popular phrase in this community is, if you've seen one autistic person, you've seen one autistic person. There's a ton of diversity in this community that isn't yet well understood, but has an incredible impact on each person. Amaral is able to show this through his work looking at the amygdala, a brain structure that plays a big role in anxiety, at least in neurotypical people.
And we've studied the amygdala, just looked at its development over time using MRI in living autistic children. So we followed them from when they're 2 years old into their 20s. And what we found is that anxiety in autism can actually be of two varieties. It can be the standard kind of anxiety. It's called the DSM type of anxiety. That's what any neurotypical person would have. But then there's also an atypical form of anxiety that seems to be only occurring in autistic individuals.
This type of anxiety is often related to patterns. If something is different than it appeared the day before, a person may get really anxious about that change.
So one of our children was upset when there was a cloudy day and the sun didn't rise the same way as it did yesterday. And, these are things that neurotypical individuals wouldn't necessarily be anxious about, but this child needed to have things done in the same way exactly every day. Otherwise, they got anxious.
What's interesting is that the kids with the typical type of anxiety had larger amygdalas than kids without any anxiety, but the ones who had the atypical presentation had smaller amygdalas than both groups.
So here you have, even within autistics, a divergence that some had a big amygdala, had DSM anxiety, some had a smaller amygdala, and they had this atypical anxiety. But then there was a group of autistics that had no anxiety disorder that we could determine, and their amygdala was normal size.
Which is just one example of how diverse this population is and how much we don't understand.
And it speaks to the issue of why we really need a large number of donations of postmortem brains. By looking at one brain, it really will not characterize all of the differences we see between autism and neurotypical individuals. We ultimately would like to know what's different about an autistic individual that has autism plus anxiety versus somebody who only has autism, or autism plus epilepsy versus somebody that only has autism. And the only way you can do that is by having a large number of people with autism plus anxiety or autism with epilepsy comparison to autistic individuals with neither of those, as well as comparing it with neurotypical brains that don't have autism.
At this moment, Amaral estimates that they've collected around 400 donations. It's much more than what was available several years ago, but he says many more are needed to get the answers they're looking for.
I think there may be some novel findings that we'll see in the autistic brain that will give us clues as to why some of the medications that we think should help them are not helping them. And then there'll be other findings that will lead us to new targets for therapy. So science, unfortunately, is slow and it takes some time. And this is, I think, in compared to something like Alzheimer's disease, autism is far more complex. And so it's probably altering or affecting multiple brain systems, not, one or two. And we need to encourage more research on all of them. But again, unless you have the substrate to do it, which in this case was the postmortem brain, you can't do the science.
You can find out more about brain donation and Dr. David Amaral on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our executive producer is Amira Zaveri. I'm Kristen Farrah.
Quick question. Do people come to you for answers at work? Maybe you're managing projects, training new hires, or just the one everyone relies on. That's leadership. Through UVA Darden's part-time MBA in Roslyn, we help professionals like you turn real-world experience into recognized leadership credentials without stepping away from your career. Whether you work in healthcare, education, government, or business, this is how you take the next step. Learn more at darden.virginia.edu/PTMBA.
Summer's a gift. The gift of days that last a little longer, a brighter state of mind. So gift yourself a new Kia at the Kia Summer Sticker Sales Event. With specially tagged vehicles including the Sorrento, Sportage, Carnival, as well as the Niro Hybrid. All backed by a 10-year, 100,000-mile limited powertrain warranty. So the gift of summer can keep on giving for summers to come. Kia, movement that inspires.
Call 800-333-4KIA for details. Always drive safely. Event ends 6/1/26. See dealer for warranty details.
Morning people wake up for peace and quiet. McDonald's breakfast people, we wake up for the sweet rush of getting that warm, delicious breakfast right before it ends.
Hotcakes, sausage patty, hash browns, scrambled eggs, biscuit, real butter and syrup. You know how our big breakfast got its name, and you know where your whole family can share one for just $6. McDonald's. Limited time only. Price and participation may vary. Cannot be combined with any other offer or combo meal.
Ba-da-ba-ba-ba.